Okay, I'd like to welcome everybody. Today we're gonna make a video, and I'll go over the choking episode. Okay, how to respond to a patient or your coworker when they are going through a situation where they're choking. So there's two parts to choking. It's either partial type of choking or you have a complete blockage of the airway, and now it stops you from breathing. Basically, it blocks the air that you breathe, and it causes you to panic. At some point, it becomes a life-threatening event, and we have to respond accordingly. I'm going to go over just our setting here at Seacrest. We have an assisted living, we have an independent, we have a cats in memory care, and we have our skilled nursing. So there's different levels of care, and like each one of these units have different guidance on how to respond to patients that are choking. I'll go over how to respond based on which unit you work in. Okay, so as you know, these residents are 65 and above, and they some of them are confused, and their mouths are dry, whether because they're not drinking as much, they're dehydrated, or they're taking medication that literally affects their ability to swallow effectively. Some of these residents are wearing dentures, so it makes it even that much more difficult uh, to swallow, or you have more incident of choking because of that. So I'll go over steps to prevent choking in the dining room. Here in our skilled nursing, there's certain things that we can do to alleviate some of those events, or maybe prevent it from happening. Some of your patients that are just coming from the hospital, they're weak, they've gotten a lot of medication, including narcotics. Yeah, they're weaker, they're more confused. So a lot of times their swallowing is affected by this in a negative way, obviously, right? Like we change their diet, we would change their regular diet. Maybe they had a regular diet before, and now we change it to mechanical soft, or we would go down even further to puree, and some residents are even on liquid diet only, right? And this is all because at the hospital they've spent so much time at the hospital, or have taken so much drugs or whatnot, that their swallowing is pretty weak, right? They can't swallow correctly, and it causes a choking event. Other things we can do is thicken their liquid, so even just drinking water or drinking any kind of liquid, coffee, right? um, Typically when your throat is shaped into an L, so when you raise your head up like this, it makes a straight line. So when you're drinking water or anything liquid, that goes straight down. So we have a technique here in skilled nursing, and this is taught by our physical therapist, where if you have somebody who has difficulty swallowing, you'd make that L-shaped type of swallow. You tell your resident to tuck their chin. So when you're swallowing, when you take a gulp of water or liquid, you want to tuck your chin in. That keeps the liquid mostly here, and you have the ability to control the when to swallow those liquids.
Extends their neck or tilts their head back, their airway opens up. This posture is used during CPR to improve breathing. However, during a swallow, we want to protect the airway, which is a different position from the one we use during resuscitation. For most people, simply keeping the head in a neutral position will lead to a safe swallow. During your swallowing testing, your SLP determined that you benefited from your head in an exaggerated forward tilt. This posture is referred to as a chin tuck. Notice how the chin tuck narrows your throat and the entrance to your airway. This can help guide food and liquid away from your airway, making aspiration less likely. To perform a chin tuck with liquid, take a sip of your drink and hold the liquid in your mouth. Tuck your chin down to your chest and then swallow. To perform a chin tuck with food, take a bite of food and chew until the food is ready to swallow. Then tuck your chin down to your chest and swallow. Your therapist will tell you if you need to do this only with certain swallows, or if you need to do this with all swallows of liquid, food, and medications.
So That's a technique that we use. Also, we try to avoid straws. Straws brings those fluid right to your esophagus, and you don't have the ability to control those fluids. So straw is really contraindicated for patients that are having difficulty swallowing. We remind our residents to eat slowly. We cut their foods in smaller pieces, and we monitor them closely to make sure that they have the ability to swallow effectively. If we notice that the patient continues to have issues with swallowing, we might even call the doctor and change the diet even further, or we would stop the meal altogether if the swallowing or coughing is significant. Proper positioning of patient when in bed is also really important when you're dealing with patients that are high risk for choking. Um, some residents are kind of left, laying there comfortably. We leave their food there, and we don't realize that, hey, this patient maybe is a high risk for choking, and it's really important to keep that head up, and inform the resident to make sure that their head of bed is at least 60 degrees or higher to prevent, or to decrease the incidence of choking. Okay. I'm gonna go over the importance of back blows and abdominal thrust because these are the techniques that we basically use when somebody's choking. But first and foremost, we need to probably figure out first whether the patient has a truly a medical emergency where there's a full blockage. If the patient is coughing and showing signs of choking, um, we need to figure out whether it's partial choking or if it's a full blockage. Now, partial choking means that somebody's coughing, saying that they're choking, but it's not a full blockage. You shouldn't really do anything for this resident. The only thing you should be doing with this resident is guiding them, telling them lean forward. You shouldn't be doing any back blows. You shouldn't be doing abdominal thrust. You shouldn't be touching this resident. Okay. What you could do is just really coach these residents, or just verbally tell them that, hey, lean forward and try to cough it out. The worst thing you can do at this situation is lean back and start drinking water, right? That water is going to make it worse. You're going to go from partial to a full blockage. If you try to give this resident something to drink, you don't want to give them anything to eat to try to like dislodge it. You want to continue to lean forward and cough to make sure that foreign object is expelled out by coughing. Um, it's a different situation though when you have somebody who has a full blockage. You can really tell when somebody has a full blockage because now you're you have clinical signs of like an emergency situation where your lips are blue. You will not be able to cough. You will not be able to talk. Okay, I know a lot of people say, hey, I'm choking. If you're verbally able to say that you're choking, you're not choking. It's one of those situations where if you're not turning blue and you're talking and you're coughing clearly, you don't have a full blockage. In that situation, all you're doing is really coaching the resident and just say, hey, lean forward and keep coughing it out. Okay. The only time, and this is the most important part, the only time you need to start doing back blows is if this resident is truly going like this with international sign of choking, is when you're putting both hands like this, or you can't cough, or you can't talk, or you're turning blue, or all of the above, right? Now you have full blockage. That is an emergency situation that you're in. In those situations, you would start by doing back blows. You want to lean this patient forward. You want to make sure that you have your hand over their chest like this, and in the other hand, you're doing 5 physical back blow. The use of your heel right here. You're hitting in between the scapula. I'm gonna have a video kind of showing how that's done, but I'm just going over the basic stuff to what we should be doing. But using the back of your heels right here, hitting in between your scapula, and you're digging down like this, and then up. You're hitting that back. The thing that I want to remind people is that sometimes we're doing back blows and you're just really like going like this, and you really got to be hitting hard on the back. You want to try to expel that foreign object out that's blocking the throat, and in order for you to do that, you're gonna have to hit hard. Okay, and again, is a full blockage. This person is probably gonna die if you don't do it correctly. So it's really important that we actually do and hit the back of the scapula of the back, in between the two scapula, with the back of your heel pretty hard. You know, they're not gonna die if you hitting him, but they will die if you can't get that blockage out. Okay. The other thing is, if that doesn't work, you do 5 back blows first, and then you go up front, and or you get the patient. If the patient's not in a wheelchair, you got him standing up. You want to do 5 abdominal thrust, and that's 2 inches below the navel area, and you wanna push in, right, abrupt, really fast, and up. So in and up, and we have a video for that as well. And you're going to do it 5 times. Check to make sure that the foreign object has expelled out. If not, you want to go back and start doing back blows, right? You're going to keep repeating that until the object is gone. At some point, if it doesn't go away or if it doesn't get expelled out, that patient is going to start you know falling unconscious, right? They're going to be unconscious, and then you're going to have to do CPR. We're not talking about CPR today. All I'm talking about is abdominal thrust and back blows, which is for choking response. And so in a situation where the patient becomes unconscious, you'd have to do CPR. There's no more pulse, there's no more breathing. That's when the nurses or anyone who's trained in CPR can do the CPR technique. The other thing I want to go over is that if you're in skilled nursing and you completed the process, or let's say it's a full blockage, this is the situation where you'd open an event, you'd monitor the patient. If the blockage has gone away, we may call 911 depending on how the patient um, is responding, right? If they're fully awake and they're okay, usually we just open an event, we monitor vitals for 72 hours, and we see how they do. A lot of times, though, when patients has a full blockage, they might have pneumonia. So this is why in skilled nursing we monitor these patients, take their vitals every shift, and monitor for symptoms of pneumonia for the next 72 hours. In assisted living, if you have a full blockage, or you're in independent, and you had an event where you had a full blockage, you'd have to call 911. Okay, there's no, even if they're doing okay, you still want to call 911. You want to touch base with a family member, obviously, and let them know that you had this event. And that's the time. That's the difference here. I think the big difference in terms of what we need to do for our independent resident and assisted living resident is that if you have a full blockage, you'd call 911. Even if you have a partial blockage, sometimes you do have to call 911 depending on how that patient is reacting in assisted living. In skilled nursing, because we do so much monitoring, we have nurses here 24/7. We don't necessarily have to call 911 for these events. It just really depends on how they've reacted to that event, and if we got the foreign object out, how are they doing at the current moment. So we have stat x-ray here, we have stat labs. That's not the same for assisted living, and this is the reason why when you have a significant event in assisted living, you have to call 911. Okay, I'm going to show some videos on how to get rid of, on how to respond to somebody who's choking, and the technique to do back blows and abdominal thrust. Remember, most important thing is, when you do have to do back blows or abdominal thrust, is when you have a full blockage. When you have a full blockage, complete blockage, whatever you want to call it, it's the time when you can't breathe and you can't talk and you can't cough. Okay, partial blockages, remember, we don't do anything for this patient. We don't do back blows. We don't do abdominal thrust. If they're telling you that they're coughing, right? If they're coughing and it's clear, right, and you can hear them cough, right? If that means they're not choking. They might have some partial blockages in there, but they can still breathe. Okay, I guarantee if somebody was choking and there's a full blockage, you're not gonna be able to cough. It's gonna be like a gasping type of cough. So, but if you have a partial blockage, you're gonna be able to cough still. So that's the most important thing in terms of a full blockage and a partial blockage. Let's watch some of these videos real quick here, um, on back blows and abdominal thrust.
Caring for a responsive choking adult consists of 5 back blows followed by 5 abdominal thrusts. Watch as Richard and I demonstrate this care for a choking adult. To perform back blows, first position yourself to the side and slightly behind the choking person. Then place one arm diagonally across the person's chest and bend them at the waist so that their upper body is as parallel to the ground as possible, like this. This position helps remove the object and allows you to brace yourself if the person becomes unresponsive. At this point, firmly strike the person between the shoulder blades with the heel of your hand. Now I'll simulate 5 back blows, but I will not use full force as I would if Richard were actually choking. 1, 2, 3, 4, 5. After back blows, if they are unable to call for speak, give abdominal thrusts. First, find the person's navel with 2 fingers. Then, move behind the person and place your front foot between the person's feet with your knees slightly bent to provide balance and stability, like this. Next, with your other hand, make a fist and place your thumb side against the person's stomach right above your fingers. Finally, take your first hand and cover your fist with that hand. Then pull inward and upward to give an abdominal thrust. Now, I'll simulate 5 abdominal thrusts. Again, I'm not going to use full force. 1, 2, 3, 4, 5. Continue giving sets of 5 back blows and 5 abdominal thrusts until the person can call for speak or the person becomes unresponsive. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. If a person is pregnant, too large for you to stand behind and reach around, or if the person is in a wheelchair, you may need to give chest thrusts. Ready, Marla?
Yes.
To give chest thrusts for a responsive person, make a fist with one hand and place the thumb side of your fist in the center of the person's chest. Grab your fist with the other hand and give quick thrusts into the chest. 1, 2, 3, 4, 5. It is important to know that back blows, abdominal thrusts, and chest thrusts are all equally effective for responsive choking, but it may take more than one technique to clear the airway.
Okay, so today we're going to demonstrate how to provide or give back blows and abdominal thrust for a patient who is in a skilled nursing setting or assisted living that's as wheelchair bound. So over here, Viviana is choking, and our nurse that's going to be providing the back blows and abdominal or chest thrust is going to be Blanca. So our patient has indicated that she's choking. She's got a full-blown choking here. And Blanca is going to start with 5 back blows, right? Wow. So 5 back blows using the heel of her hand in between the scapula. You're going to lean her over, and you're going to go ahead and give the back blow, Blanca. Ready? Just like that. She's actually, in the real life, she would be picking up her hand and be hitting the back of the patient's in between the 2 scapula. Okay, so you're gonna do 5 of that. She's gonna check and see that the foreign object is gone. It's still there. She's actually still choking. So if Blanca is able to put her hand around the patient, she'd be doing abdominal thrust. But in this situation, the wheelchair is too big. She's gonna be doing chest thrust. Just at the base of her sternum, in between her chest there, she's gonna do 5 chest thrust. So 5, 1, 2, 3, 4, 5. So these chest thrusts, I want to kind of explain this because a lot of times in our trainings, I notice that people are not actually doing the back blows effectively. So if you're just sitting there hitting or rubbing people's back, it's probably not going to work. You have a patient here that's probably close to dying, right? They can't breathe. You have to like put some power in your back blows. Also, chest thrust. You gotta have some oomph in there, right? We gotta get this foreign object out. All right, so it's not working, right? This patient continues to struggle with breathing. So Blanca is going to continue to do back blows until it's all gone, right? Or if it's resolved. But at the moment, we've done 5 back blows and 5 chest thrusts, and it has not worked. And the patient is now turning pale and blue, right? So we now have to take this patient down because it's likely we're gonna have to do CPR. So as you can see, most wheelchairs have these arm bar. So just know that you can't take those off. You would want to tip this wheelchair over and help the patient out of the chair, and then we can do our proper CPR technique. Okay? All right, perfect.